Welcome to the video tutorial for the screening of studies to be included in our systematic review, occurrence and transmission potential of asymptomatic and pre-symptomatic SARS-CoV-2 infections. In this video, I will focus on the criteria and relevant aspects to take into account when screening studies that will answer question 1. So let's review question 1. Amongst people who become infected with SARS-CoV-2, what proportion does not experience symptoms at all during their infection? The outcome, truly asymptomatic people with SARS-CoV-2. The inclusion criteria, the study population, individuals of any age tested for SARS-CoV-2. The condition, SARS-CoV-2 infection diagnosed with a molecular test from any anatomical site. The outcomes, SARS-CoV-2 infection symptom status documented with a follow-up period of 14 days after the last possible exposure date or 7 days after diagnosis or until negative RT-PCR result. Publication type, manuscript reporting primary data irrespective of publication status, and we won't apply any language restrictions. The eligible study designs, cohort studies, case control studies, and outbreak investigations. The excluded study designs, reviews, editorials without original data, case reports of single cases, case series that do not enroll consecutive patients, contact investigations of a single family or individual, and case series of already diagnosed cases. So here I'm going to show you a couple examples of studies that should be included in this systematic review. Before showing you the examples, I want to clarify that this screening is not the conventional screening that you do for a systematic review where you read the title and abstract and then you decide if you should include or exclude this study. Here, because of the inclusion criteria, most of the time you have to go to the methods and results section to decide if you should include or exclude a study. So let's start. This is the first study. This is a study about an epidemiological investigation of 24 COVID patients associated with a supermarket cluster. So let's remember the inclusion criteria. So here, the study population, individuals of any age tested for SARS-CoV-2. SARS-CoV-2 infection needs to be diagnosed with a molecular test from any anatomical site. And this is very important. We have to find if the study reports our outcome, that is SARS-CoV-2 infection symptoms status documented with a follow-up of 14 days after the last possible exposure date or 7 days after diagnosis or until negative RT-PCR result. So this is the abstract. Here we have the objective. So here they want to analyze the epidemiological and intergenerational clinical characteristics of COVID-19 patients associated with this cluster. Here in the methods, we have something that is really important, and this is that all close contacts of the patient were screened since the first supermarket employee with COVID-19 was identified. So this is very important because we know this is an outbreak investigation and patients were not already diagnosed. And here we have some information about the number of patients who were asymptomatic. So here we know that 7 patients were asymptomatic, but we don't know if they were diagnosed with a molecular test and if the follow-up was enough to determine if these patients were truly asymptomatic. So that's why we have to go to the methods and results sections. So here in the methods, the authors mentioned that a confirmed case was defined as a positive result to real-time RT-PCR. So here we know that the patients were diagnosed with a molecular test. So yes, this study should be included, at least for now. And then they mention again that patients were screened after the first patient was identified, the first supermarket employee. So we know that in this study, they're not including patients with that were already diagnosed with COVID-19. So for now, yes. And here we have information about the follow-up. So we know that patients were into quarantine, and in order to be released from this quarantine, they had a negative PCR, and then they need 3 consecutive tests. So they were released from quarantine if they had this consecutive test negative. So yes, this study meets our inclusion criteria. And here we have some more information that you can take into account. So some cases were kept in the hospital for 14 days after they were released from quarantine. So with this information, we can decide that this study meets our inclusion criteria. And so for now, it's included. And here in the results, we have the information about the number of asymptomatic patients. This is our second example. It's about the experience in a hospital in Milan, and they included cancer patients. So here, this is the abstract. So here, in the methods, the authors report that they included all consecutive patients affected by gynecological cancer and developed COVID-19. And we know that these patients were treated in this academic setting between February and March. And here we have some information about asymptomatic. So here they said all patients were asymptomatic at the time of COVID-19 detection. However, with this information, we don't know if they had enough follow-up to be included in our study. So let's go to the method section. So here they mention about the type of study that they included patients who were treated in this hospital, and they were diagnosed with an RT-PCR. So yes, it's one of our inclusion criteria. And second, here they mentioned that patients were assessed. They collected information about the history of fever, respiratory symptoms, COVID-19. Then if the patients had surgery, they had a CT and an RT-PCR. And those who were not scheduled for surgery here, here they said, well, you have a reference for the details of their protocols. If you want to go and look at the reference, you can do that. But here, they said that they did nose throat swab. So here we know that all patients who attended to this cancer department were tested for the virus. It's not that they're only including patients who were already diagnosed. So let's see if they had enough follow-up. So this is in the results section. So we know that they had 19 patients with COVID-19 confirmed by an RT-PCR. And here they said all patients were asymptomatic at the time of COVID-19 detection. 9 patients developed symptoms after a median of 3, with a range of 1 to 17 days after COVID-19 detection, while the remaining 10 patients were asymptomatic. So with this information about the follow-up, we know that they were followed up enough after the COVID diagnosis. So yes, this study should be included in our systematic review. And now I'm going to show you a couple examples of studies that should be excluded for our systematic review. This is the first article. So this article doesn't have an abstract, so we have to go straight to the method section. So this is the methods. So they said that they include a total of 70 SARS-CoV-2 infected patients. So this is one of our exclusion criteria. These patients were already diagnosed. It's not a screening study where they tested everyone. And also, if you want to see some information about the follow-up, this is in the results. In this table, you can see that the asymptomatic patients, they don't report any information about follow-up. So here we have 2 reasons for exclusion. First, patients were already diagnosed, and second, we don't have any information about the follow-up of asymptomatic. So here we have information about symptomatic and convalescent patients. So that's why this study should be excluded. And this is another study, early experience with universal pre-procedural testing for SARS-CoV-2 in a relatively low prevalence area. So this is the abstract. So if you read this abstract, we have a little information about asymptomatic patients. So they only mentioned that the rate of asymptomatic coronavirus disease was below 0.5%. So we have to go again to the method section to see if this study could be included. So here they have information regarding the testing. So here, yes, they diagnosed the disease with an RT-PCR. So for now, we could say, yes, this study could be included. And here we know that they did screening for all surgical patients. So we could say, for now, yes, all patients were tested for the virus. But here we have information about an apparent follow-up. But if you read this, this is about the testing. So they said that for the analysis, we only included the first SARS-CoV-2 test result for an individual patient and an excluded test, or their only patients with stays for more than 14 days. Patients who had a SARS-CoV-2 preoperative screen test completed or had another SARS-CoV-2 test performed within 7 days prior to a perioperative event were included in the pre-procedural test group. So this is about the testing, it's not about follow-up. So with this information, we don't know, we don't have information about the follow-up for our study. So at this point, we could say we should exclude this study because it doesn't have information about follow-up, or the follow-up was not enough. And here we have more information in the results. So sometimes we have to go to the results to see if they mention anything about the follow-up. So here they said that from March 19th through April 20th, 486 patients were positive, but that's the only information we have now. And here they mentioned that no patients were recognized to have symptoms of COVID-19 at the time testing was ordered. So again, we don't have information about the follow-up, and you're gonna find a lot of studies where authors mentioned that patients didn't have any symptoms at the time of testing. But here for our review, we need to read in detail if the follow-up was enough. And then we have to go back to our inclusion criteria. So you have 3 options: 14 days after the initial exposure, 7 days after testing, or until negative PCR test. So this is everything that I had prepared. So I hope this information is helpful for you to decide if including or excluding a study. And thanks for participating in our review.